Hi, my name is Savannah Ryan, and in this PowerPoint, we'll be going over gestational diabetes mellitus and if education at the beginning of pregnancy can help prevent this. Gestational diabetes mellitus prevention is important to me because I want to eventually be a midwife, and this is something I will encounter. This topic is important to the public because, according to the International Diabetes Federation, 21.3 million, or 16.2% of live births worldwide, had some form of hyperglycemia in pregnancy, and an estimated 85.1% was due to gestational diabetes. This topic is important to the healthcare system because as GDM rates increase, hospital systems struggle to cope with the increasing demand on services, and it is clear that new ways of educating and equipping women to manage their GDM is necessary. This topic is important to the patients or subjects of my review because GDM is on the rise, and we need to know and understand interventions and ways to prevent it from occurring. For my Pidcock statement, I have chosen, for expecting mothers, does education at the beginning of pregnancy on how to prevent gestational diabetes compared to no education or education provided at time of glucose test increase the knowledge of gestational diabetes risk and prevention over a 1-year time period? For my population, it would be expecting mothers. The intervention in the statement would be education at beginning of pregnancy on how to prevent gestational diabetes. My comparison intervention would be no education or education provided at time of glucose test. My outcome would be increased knowledge of gestational diabetes risk and prevention, and my time would be over 1 year. In my search for high-quality research, I used the Cochrane Library as my first source. Initially, I came up with 766 results prior to filtering, and after filtering, I came up with 29 results. Some of my filters include pregnancy and childbirth, medical problems during pregnancy, glucose intolerance, and diabetes. My next source that I used was ProQuest Nursing and Allied Health Source. Initially, I came up with 2,175 results prior to filtering, and after I used filters such as 2010 to 2019, article, pregnancy, and gestational diabetes, I ended up coming out with 16 results. Terms and Boolean operators used was risk and prevention of gestational diabetes throughout pregnancy and early education methods. My rationale for selection of articles in this review was the research I selected was performed by highly qualified healthcare professionals with years of experience. One of the articles was conducted by Mary Carolyn Ola, who is a registered nurse and certified midwife. She has conducted research in high-risk pregnancy for almost 10 years. Randomized control studies were used in the evidence provided, and the articles were over some sort of education and prevention of gestational diabetes mellitus with significant outcomes. Some of the similarities that I found between all of my research articles were that studies included women aged 18 to 45 years old. The exclusion criteria was that women with a history of diabetes, multiple pregnancies, a diagnosis of hypertension, or the inability to read English or if they were illiterate. And this was included in 3 of the studies, and the other 2 did not include this. Studies also had randomized selection to the control or intervention group. Only 1 trial did not have randomization and went by the date that the patients were seeing the doctor. So if they were to go in on a Monday, they'd be in one group, and if they were to go on a Tuesday, they'd be in another group. Studies also continued to collect data into the postpartum period. Only 1 trial did not go into the postpartum period. All studies, although slightly different, were over either education on healthy lifestyle changes or over different ways to educate the mother early on in her pregnancy. All of this information would be included together in the education given to the mothers in hopes of preventing the gestational diabetes mellitus. The inconsistencies that I found between my 5 articles was that a variety of different types of preventative education and interventions were used in these studies. A randomized controlled trial of a web-based education intervention for women with gestational diabetes mellitus was conducted by Carolyn Olah and Sayakot in 2019. The impact of health education intervention for prevention and early detection of type 2 diabetes in women with gestational diabetes was conducted by Tawfik in 2017. The DALI vitamin D randomized control trial for gestational diabetes mellitus prevention was conducted by Korkoy et al. In 2019. Impact of an exercise intervention on physical activity during pregnancy and the behaviors affecting the baby and you was conducted by Hawkins et al. In 2014. And the effectiveness of lifestyle intervention in early pregnancy to prevent gestational diabetes mellitus in Chinese overweight and obese women was conducted by Sun and Zhao in 2016. All of these studies were conducted with different types of ethnicities to mainly make up their study population. So further studies would need to include a wider variety of populations. Some of the gaps that I found within my 5 research articles were that further studies were needed that would be larger and of longer duration to achieve more definite conclusions. Further studies should consider partnerships with local communities to increase support and incentives, as well as expand intervention participation to include the pregnant woman's family members and social network. Future studies were also needed to increase sample size and recruit women from different hospitals. Some of the limitations were that since the study was a single center trial, the results may not be generalizable to other populations, and blinding was not possible due to the nature of the intervention. The trial framework did not allow for recruiting women who had a late first antenatal care visit, which would be greater than 12 weeks of pregnancy. The study had failure to reach the intended sample size. The study was conducted in predominantly non-Hispanic white populations, and the study was not a double-blinded study, which could have led to bias. For my conclusion, I feel that there is enough evidence to support a practice change because the statistics on all of the research I have came across have shown improvement, and even the slightest improvement is a step in the right direction. I do, however, believe that we should continue to conduct more studies until we have found that missing piece that we have been looking for. I did not find a guideline over my specific topic as a whole, but I do believe there is enough evidence to support a practice change. by incorporating education over prevention methods and healthy lifestyle changes early on in a woman's pregnancy, I believe we would find that gestational diabetes mellitus rates would decrease significantly. Thank you.